Hello everyone, my name is Adriana Gonzalez and today I'm going to be talking about the ketogenic diet and its effect on weight loss. I actually first heard about the ketogenic diet at a sports nutrition conference by Dr. Jacob Wilson, where he had been presenting favorable effects in the ketogenic diet in regards to fat loss, performance, and more. What I found interesting about this diet was how high fat the content was in comparison to how low the carbohydrate content was. Due to this, I want to see how the actual mechanism of fat loss occurs when consuming this diet. As you know, obesity rates have reached a global epidemic. In the United States, 2 of every 3 adults are known to be overweight or obese. Many research studies have shown ketogenic diets have a significant role in decreasing weight loss without causing any negative effects in health parameters. So, what is the ketogenic diet? The ketogenic diet consists of about 20 grams of carbohydrates, with the majority of your caloric intake coming from fats such as polyunsaturated fatty acids and some saturated fats to induce ketosis. When glucose in the body is scarce, ketosis occurs as the body's fuel changes from carbohydrates to fats that's obtained through the adipose tissue and from the diet. Researchers such as Jeff Volek have found metabolic advantages in weight loss when consuming a ketogenic diet compared to other diets of the same caloric intake. The question is how? How can these metabolic advantages occur? Well, in researching the ketogenic diet, I found 4 primary research studies where all subjects showed favorable and significant data in weight loss and other health markers. In the study by Dashti et al., researchers examined the long-term effects of a ketogenic diet in 83 obese individuals. In this 24-week study, the ketogenic diet consisted of 30 grams of carbohydrates, 1 gram per kilogram of their body weight in protein, and 80% of polyunsaturated fats and 20% of saturated fats. Here, body weight, BMI, total cholesterol, LDL, HDL, triglyceride levels, and fasting blood sugars were measured throughout the study. So what were its findings? Well, weight and body mass decreased significantly. Total cholesterol, LDL, triglyceride levels, and blood glucose had also decreased significantly, and HDL had increased significantly. In another study by Dashti et al., researchers examined the long-term effects of a ketogenic diet in individuals with high cholesterol. This study was actually twice as long as a previous study mentioned, where individuals were given 20 grams of carbohydrates, 80 to 100 grams of protein, and its high fat content included a specific list of polyunsaturated and monounsaturated fats. Here, the 2 groups included high cholesterol versus normal cholesterol, and they measured similar health markers as mentioned in the previous study. So what were its findings? Body mass and BMI had decreased significantly in both groups. Significant decreases in total cholesterol, LDL cholesterol, triglycerides, and blood glucose levels had occurred, and HDL had increased significantly in both groups. In a study by Volek et al., they examined the difference between a very low-carb ketogenic diet in comparison to a low-fat diet in overweight individuals. Subjects were given 2 energy-restricted diets within the same caloric intake, meaning they had a 500-calorie deficit. The ketogenic group received low carbohydrates to induce ketosis, and the low-fat group was given the standard recommendation. Measurements here included weight loss, body composition, trunk fat mass, and resting energy expenditure. So what were its findings? Well, they found that in the ketogenic group, they had an increase in caloric intake compared to the low-fat diet group, which ironically enough, the ketogenic diet group had a significant improvement in all measured parameters compared to the low-fat diet group. Women especially favored in the ketogenic diet because they had a significant change in trunk fat loss. So this study just shows a clear significant benefit in consuming a ketogenic diet over a low-fat diet in overweight individuals. So how does this fat loss occur? Well, in a mice study by Kennedy et al., researchers explained that due to the low glucose levels, activation of AMPK leads to decreased fatty acid synthesis, thus increasing fatty acid oxidation. ACC declines in the liver, decreasing lipogenesis, where acetyl-CoA can then be used for ketogenesis and oxidation rather than fatty acid synthesis and cholesterol synthesis. So here you can see that a high-fat sucrose diet leads acetyl-CoA more towards cholesterol synthesis and fatty acid synthesis, whereas the acetyl-CoA here, when consuming a ketogenic diet, leads more to ketogenesis and more towards the Krebs cycle. So what are my final thoughts? Majority of studies showed a favorable result in metabolism consuming the ketogenic diet in comparison to other diets. A ketogenic diet can help reduce body weight, BMI, total cholesterol, LDL, triglyceride levels, and fasting blood sugars. And lastly, based on the data, ketogenic diets can be safe for consumption for individuals who are of normal weight, overweight, obese, or individuals who have high cholesterol.